Happy birthday, NHS. To celebrate the NHS's 78th birthday, we've done a special edition of the Down But Not Out podcast. This is where we've got Dr. Amit Goyal on to talk all things NHS, what to expect from a GP appointment around your mental health, but also what makeup does to skin conditions and what mental health does to skin conditions. So tune in to find out how to do your makeup to help your skin and to find out a little bit more about what the NHS is up to on their birthday.
3, 2. John, just say hello for me.
Hello for me.
Yeah, very good. So, good evening. Welcome to another Down But Not Out podcast with Arthur Ellis. And we're here with the beautiful Mr. John Manning. Hello, sir. How are you?
Beautiful. I don't know.
Oh, come on. It's radio. They don't know. Till they watch the video podcast, they don't know. So, let's go with it. If you ever want to find out more details about John, Arthur Ellis is where you need to go.
Absolutely. ArthurEllisMHS.com.
Lovely. And that wraps it up for this week. More in the next couple of weeks here with the Down But Not Out podcast. So welcome to the Down But Not Out podcast here on MKFM with Arthur Ellis, the online mental health charity, joined by the lovely Mr. John Manning, as always. Hello, sir.
Hello, Wes.
Hello. And we've got a new guest in, Dr. Amit Goyal from the Watling Street Surgery. We've got a doctor, which is good.
We have a doctor.
I've got a load of questions. I feel safer already. I do.
And now it's incredible. So yeah, we've worked together for a little while, haven't we?
About 5 or 6 years now.
Yeah, absolutely. Yeah. So yeah, it's phenomenal to have you on. So thanks for coming and giving up some of your extremely busy time in primary care.
Absolutely.
So give us a little bit about your history. You've been in primary care how long, Amit?
So thanks for having me on the show.
Yep.
I've been a GP since 2009, approximately, and always been in Milton Keynes. I also do other bits and bobs like dermatology and running something called a primary care network. But yes, I've seen lots of changes in general practice over the years. Some have been absolutely great and beneficial, but unfortunately some have also made things a little bit more difficult for us in primary care.
And I suppose the thing is, we talk about the changes. Obviously, one of the reasons we're doing this podcast is because in the last, 10 years, the availability for support for mental health has changed massively. Years ago, 2009, that's when you started. It wasn't the emphasis on the benefits of looking after your mental health in the same way. So that's got to be a massive change for you.
Yeah, absolutely. And what we're finding is people are perhaps coming to see us a little bit more early in their journey of having poor mental health, which I do think is great. But unfortunately, that also puts increased pressure on trying to get appointments. And
will be more people.
It
just increases the population of people who are coming to see you.
Absolutely.
And I use the term primary care, Amit, and I'm sorry about that, without explaining what it was. So could you just say what primary care is? So
primary care is essentially general practice and all of the services that we can provide within general practice. So again, 10, 15 years ago, we had the usual model of seeing your GP, but over the last 5 or 6 years, we've the funding structure has changed slightly, meaning that we can employ other allied health professionals. So people like podiatrists, physiotherapists, and mental health caseworkers. So you may see another allied health professional, but you may not necessarily see your GP.
Right.
And I think that's been one big sea change that we've had over the last 5 years, not just because of COVID, but also, like I said, the funding structures. But they're always supervised by a GP. So if there are any concerns, clinical concerns, safeguarding issues, our allied professionals will always come to us.
It's so vast, primary care. Like, I think people go in to see your doctor, but everything that sits behind the scenes, the additional services that you can get, like social prescribing and things like that. Because I don't want to speak out of turn, or hopefully I put this in the right way, but a lot of people who are going to the GP for mental health appointments don't necessarily need a GP. There could be a variety of other avenues that they can take to get support.
Yes, so we've been quite proactive with our mental health support. Unfortunately, still not enough, but we have been proactive. So Watling Street Practice, we have contracted the services of Arthur Ellis for our young children and young people for their mental health, which has been working absolutely fantastically. But unfortunately, other surgeries don't necessarily have those services, and and across the country, those sorts of services aren't available to contract.
Right.
We also have a social prescriber, because as we know, mental health isn't just about low mood. There are triggers for that, so things like financial issues, learning disabilities, those sorts of and housing, things like that. So our social prescriber is able to help us and help our patients to tackle those kinds of issues, which hopefully in turn would help with
it's like getting to the core of it, really, isn't it? The core thing that's impacting your mental health, and it's not often just happening for no reason. There's usually a societal issue, lifestyle issue, something like that surrounding it,
and you always have to dig down. So during our consultations I keep saying the good old why. There's usually some sort of reason. Granted, there are some clinical cases where people just have clinical depression for absolutely no reason.
Right.
So we do have those cases, but usually there is a why.
Yeah.
Stress, anxiety, bereavement, stress at work, stress with family, and it's tough times we're living in.
So that's the catalyst for that thing, because that's incredible. Do you know, I didn't even think about that, because obviously going to a doctor, you feel like I'm suffering, I feel ill, and you go, well, it's a medical thing, but actually, so was it a prescriber? What did you say? The gentleman or the
social prescriber?
Social prescriber. I've never heard that phrase before ever. What order does that? So someone would come to see you. They would come into and say, I'm feeling stressed, I'm feeling all these things, and you would ask the question why, and at that point there you would give them access to the social prescriber. Does that how it work? Sorry, just in terms of layman's terms for me.
So it's another sort of avenue that we could explore. So if we thought, for example, someone was having trouble with their housing, or having trouble with filling out benefits forms, something like that, then we could signpost them to the social prescriber to help them with that.
Right.
We would then look after the GP would look after the clinical problems. So if prescribing some counselling or prescribing antidepressants is appropriate, that's absolutely fine. We would do that. But then as another add-on
service,
management support service, then we can refer to the social prescriber.
Wow.
So what is a day like in the life of a GP when it comes to mental health appointments? Is it a lot of your time? Do you see a lot of patients who are coming in for those reasons?
We do. I don't have the numbers, but we're probably looking at sort of at least 10 to 15% of our on the day caseload could be related to mental health in some form or other.
And within that, what's the percent? Oh, we can't give the exact, but out of that, how much of it is something that could then be handed over to the social prescriber, and how much of it is actually a medical, physical issue? Is that?
I'd say probably 20% of those will have something that could be looked after with the social prescriber as well.
Wow.
But a lot of it does end up
medical
needing to be looked after by the GP or our. But we not only do we have a social prescriber, we also have a mental health a worker as well.
Okay.
Who sees the lower level psychological
maybe those
problems.
early interventions,
things, absolutely.
Right.
And then she has a liaison with our secondary care team. So we are trying our hardest to create these pathways at Watling Street Practice, but there is a disparity, and unfortunately not all areas of Milton Keynes or even the country have those pathways, and so we've worked really hard, not just with John but other organisations, to try and implement that.
And you're doing it phenomenally well, because I've been involved in some of the community groups and stuff you guys put on as well. So there's a lot more that GPs can offer, I think. And you said earlier on about, we kind of said about people going to the doctors, I think it was you, Wes, and sort of saying to the doctor, like, I'm feeling stressed or anxious or whatever it might be, but you've got a dermatology background as well, and sometimes is it fair to say that people could go to the doctors for another reason and then discover it's mental health?
Yeah, we see that all the time.
Do you?
Really?
Yeah. Okay.
So you can have what we call somatic manifestations. So when people are stressed or depressed, that comes out in physical symptoms.
Wow.
So, body pains, muscle aches, headaches, all of those sorts of things can sometimes be related to psychological problems.
It's
so we do see that a lot, and we may not pick that up at the first time.
Yep.
But when you build up a picture of if a patient comes in on a regular basis for those similar symptoms, then you need to start asking different questions.
I won't like Amit. You're like a detective. I'm literally
absolutely
going to get a trench coat, one glass thing.
Yeah.
I just want. Do you know what I mean?
Without shining a light in someone's face, really aggressively.
That's exactly what it is.
But it is because you're literally looking at at somebody and going, right, I've got to figure out and send them to the right place, because there's so many different, I presume, solutions for this as well. And that's why we're going to be coming back, because there's so much more to talk about. I've learned stuff already.
Me too.
Every day's a school day for me, John. We all know that. Thank you, Amit. Right, we're going to be rejoining Amit and talking more in depth about some of this subject matter next. So welcome back to the Down But Not Out podcast here on MKFM with Arthur Ellis and Dr. Amit Goyal. Now, we've talked about certain things that has already blown my mind about that somebody may come in with a physical ailment and then we trace it back and it comes about because of mental health. There was a very specific phrase you used to describe that.
Somatic presentation.
Somatic presentation. Wow.
Yeah, it makes sense, because when at Arthur Ellis, when people come to us, they always have a first appointment and a first phone call. Mm-hmm. So in that we take on what we call the presenting needs, but there's always something underlying or something else going on. And I don't know, maybe not always, but do you see that? And do you see people coming to the doctors with a physical issue, turned out to be mental health? You said earlier on that happens all the time. So I was keen to find out a bit more about that.
Yeah, so I specialise in dermatology. So in my dermatology clinics, when I'm consulting, we do look out for those signs of a somatization. So classic examples, and it might be good for you to look out for this in your sessions. When we're stressed or when we're anxious or depressed, we will do certain things. Usually it's things like scratching your skin, and introducing like an eczema almost. See this a lot with people going through exams or major stress, and then people picking at their skin.
Right.
So there's a condition called acne excoriae. It looks like acne, but it's just lots of little sort of scratched out spots on the face.
Wow.
and something else called trichotillomania, so people pulling out their hair, or classically men pulling out their beards. A lot of that can be related to
you told me
stress
about
and
this
anxiety.
the other day, the pulling out of beard hair. And I wouldn't call most of what I've got a beard.
It's beautiful,
but it's
lustrous. Lustrous it is.
I call it trying. That's what I call it. But I've pulled out and nicked a couple of hairs before, and it's so painful. So do people do that? Like, is it almost an inherent thing? Is it conscious?
Sometimes I think it's both.
Right.
I think it can be an inherent thing, and it sometimes just pacifies the person who's doing it. And I think sometimes that pain response is almost a beneficial response for them, which is very bizarre. Why would you hurt yourself? But sometimes I think it does detract from.
So it's a distraction. So you're going through something and you want to feel a different type of distraction to concentrate on something else other than the pain.
Yeah.
Wow.
Yeah, so it's a way to cope, isn't it? It's like it's a method of people find and it may, I don't know whether it's too strong to use the term self-harm, but
well, I was just thinking that.
On
a similar, very low. I don't want to belittle self-harming, but to some extent it is. And when you are pulling your hair out, we see patients with big bald patches on the beard area and on the scalp. It is a way of self-harming because they can end up with scarring and other problems. So
do you think a lot of people don't go to the doctors because of this stuff?
Yes, because it's, as far as they're concerned, it's not really an issue.
It's
not,
just like a habit.
It's not medicalised, so to speak.
Right.
But it's one thing just that we keep an eye on, obviously. And you'll probably start to notice it in your clinics.
Yeah, we do, well. and I think this is one of the things that we do look out for. And I think like there's other examples. We had an elderly client come to us, or beneficiary come to us, and they were depressed and low mood and sometimes angry, and the family were looking for ways in which we can discover what's going on with this person. And it turns out they had a UTI, and it was impacting their mood so much that they got referred into a wellbeing mental health service. So these things can have a big impact, can't they? But it's about reaching out and finding out why this is happening, like we said about earlier, the core issues behind it.
But it, like what we've spoken about so far is, like you said, but it's the person doing stuff to themselves. But what about the other way around? Is there elements where it's literally the chemicals that are going on, and then it comes out in actually like a physical form of eczema, not scratched or caused by yourself? Is there other things like that? I mean, you mentioned feeling lethargic and stuff like that, but that seems like a sensible, normal one. If we're stressed, we feel a bit tired. But other things that could come out in a physical way?
We see that very commonly with psoriasis.
Right, okay.
Where people have, their skin's been absolutely fine for years and years, and all of a sudden they've either had some physical stress or emotional stress, if they've been in hospital or bereavements, and then suddenly they just flare up with psoriasis. And the number of the times I hear that story, if I had a
pound for that, you wouldn't be here. You'd be on a beach somewhere. We understand that. We understand.
It's incredibly common, and even sort of new start of eczema. And there's another condition called lichen planus, which does seem very much stress related.
So what was that?
Lichen planus. It's very rare.
Lichen planus.
But we do see it.
What does that involve?
It's another itchy skin condition which comes out in small sort of purpley little lumps, which is very, very itchy.
It's really interesting because when I first started in radio about 20 years ago, it was quite stressful because it was a significant change in career and stuff, and I've got a lot of scarring on my face.
Okay,
this isn't teenage acne. This is from I was about 23, 24, and scars and all this sort of stuff. That came about, and it was a form of acne that I could only put down to stress. You know what I mean? I went from I used to have an outdoor job, gardening. Probably sound like a window cleaner still, and then I went into being in an office, and it was quite high, and all of this sort of came out, and I didn't really think of it as being stress because we're talking 20 years ago, and it wasn't looked at that way. But now, the more and more I hear about this stuff, I go, that could have been as potentially.
We are seeing a lot of adults with acne as a first presentation in adulthood.
Right.
So they were completely clear of it in their teens, and then all of a sudden it's flared up.
Yeah.
And again, we're seeing that a lot. And I can only put that down to stress.
Yeah. And then and that's a mental health condition. You know what I mean? The stress.
And I've been in mental health services all my life. Well, since about 5-6 years old. And where I know that when I was younger, I had psoriasis really badly, and I think, well, it's not come back, and it's been sorted now, luckily, and I'm grateful for that. But it shows how impactful the mind can be on all of the body, like you say about scratching and things like that. But I've heard of something as well called impetigo. Does that come up with stress? Is that
not really? Impetigo is basically a bacterial skin infection.
Right. Okay.
So generally, doesn't.
Because I thought it was really similar to psoriasis, and I think before it looks quite similar. So I thought it was something.
No, I mean sometimes when people have psoriasis or eczema, then obviously the skin is a bit more. The skin barrier is depleted, so you're more prone to skin infections. So you can get impetigo on top of the eczema or psoriasis.
So can these things escalate if you don't get them looked at and sorted?
The skin conditions?
Yeah.
It's very variable. So you could still have lots of mental health issues and stress, and it's relatively under control. But some people, it just escalates and gets worse. I've not really noticed a worsening of it.
Yeah,
but there's more of a persistence.
Is there a bit of a snowball effect? Because I can imagine if there's a skin condition present, that's going to impact on mental health, and then the mental health is going to impact on the skin condition. So can there be sort of like a back and forth with it?
Yeah. Yeah, it does happen. And obviously we go back to the scratching and itching. The more stressed you are, the more you scratch. Because you just want that momentary benefit. And then that definitely makes things like eczema and psoriasis a lot worse as well.
And I suppose in the very image conscious world in which we live, that there is another thing. If you've got, because not about me, but I remember getting this acne at 24 and going, I want to hide away a little bit more, and made me feel a bit lower. And then if you're feeling lower, then your mental health goes down, and then other things come about. So it's
I think the problem is now that was 20 years ago. I mean, if
I've grown into my looks from there, just to make that absolutely clear. I'm stunning now.
If you fast forward to now, with social media has just caused a bit of a snowball effect where you're looking at people who are going through filters and their skin looks absolutely amazing.
Yes.
But actually, if you take those filters off, they've probably got bits of acne, scarring and pigmentation.
Like a normal human being, almost.
But one big problem now is the expectation, especially for younger people with acne, is that they need to clean their skin. They need to get it as clear as possible, as quickly as possible.
Yeah.
And unfortunately, we're seeing a lot of people young people are almost over-treating themselves with what we call actives, so things like retinol, salicylic acid, and causing major problems with their skin by over-treating it. And that's one of the reasons why I set up my Skin Doc. It was my private online clinic. Is you need some guidance on how you're going to improve your skin, not just trying different things. Because trying different things can lead to a lot of.
And there's so much out there, and I suppose if one thing I really want to ask you, it might be best to wait after this little break, but you've said about people treating their skin with all of these acids and stuff, but I'd really like to find out what makeup does, because on the other side of it, I would probably ignore it or cover it up and all of that sort of stuff. So it'd be really interesting to find out more about what.
So basically, we're going to come back for some makeup tips for John. Which is,
basically,
I won't lie, the podcast took a pivot that I wasn't expecting. But
I don't know why I'm so interested in the makeup side, but I just want to
say I specialise in that. But
just something to make those eyes pop, John. That's what it is. Right, we will be coming back for more from the Down But Not Out podcast here on MKFM. So welcome back to the third part of the Down But Not Out podcast. The guys are laughing at me because I
just spent 10 minutes trying to say dermatology
expert.
Shall I introduce myself?
Amit, if you could, that would be great. So what's your job role, please, sir?
I'm a GP by trade, but I specialised in dermatology for the last 13 years.
Which is exactly what I've been saying, dermatology.
Yeah, that's exactly why I want to bring up and find out more about makeup.
Yes.
I know it's a bit odd, but we've talked about skin conditions and the impact that it can have on mental health and vice versa and things like that. So you've sort of said that people can overuse sort of seemingly helpful things that they can use. But what about if someone doesn't do that and wears a lot of makeup to cover up? And because obviously these conditions can make you, I can imagine, make you really self-conscious. So covering up could be a big thing for people.
Unfortunately, covering up is probably the worst thing that they could do.
Really?
It's really important, and I completely appreciate the need to sort of go out, go to college, go to school, go to work, and look sort of presentable, so to speak. But the hard work, if you put in the hard work for even 2 or 3 months into your skin, then you'll realise that you'll need less makeup. The problem with makeup and the cover up is it's quite thick. And can be quite gloopy, and there's certain oils in that makeup which can then cause further problems with acne. Acne is an inflammatory disease, and there is a bacteria which causes that the pus to form, and so all you're doing with those extra oils and essentially creating a roof on the skin is you're just exacerbating that infection and making it potentially worse.
Might be a really silly question and quite naive, but we promote people to do exercise. We've got these 5 areas of well-being. So move, exercise, focus, calming activities, discover is about learning and accomplishing something new, communicating is seeing your friends, and then helping others. So we've got these 5 areas of behaviour that if we do them all the time, we're going to have a positive well-being as possible. when it comes to using or having a skin condition and covering up with makeup and things like that, is it advisable to keep up with your exercise? Is that going to help, or would sweating and getting dirty through exercise be damaging for these sorts of conditions?
It's definitely really important to exercise. It's great for skin health and also mental and physical health. So certainly would not promote not exercising. Ultimately, you can after you've had a workout, you can clean the skin with a decent cleanser.
So keep on with normal routines.
100%.
Be as healthy as possible.
Absolutely,
that's all going to aid.
Yes,
not just how you feel mentally, but the actual
skin and how you look and stuff like that. Is there, at what point do you say to people? So you've come in, they're asking questions about their skin, they're having problems with their skin. At what point do you start going? Well, it might be a mental health thing. Is there a treatment where you go, look, we can try this as in terms of the physical changes? You said about cleansing and various things like that, but also, maybe you should try this. Is that do they run alongside one another? Is there a point where you go, no, we need to deviate this treatment because it's not working in the way that we wanted? Is it as black and white as that, or
generally acne, especially, is a law unto itself.
Right.
So you could look into the whys of why people have got acne, but largely it is a hormone-driven skin condition, and it needs to be treated as a physical
entity. Okay.
So I suppose the only caveat to that is I would suggest that diet does have an impact.
Okay.
Especially sugar. So obviously the sugar in your bloodstream is going to be feeding the bacteria. So you can I think you can worsen acne, and the research goes in and out of whether sugar's a problem or it's not a problem. But I don't know about you guys, but if I eat a lot of sugar in a week, then I start getting little folliculitis areas, like small areas of pus on.
Can do, yeah.
Folliculitis.
Yeah, so it's a bacterial skin infection of the hair follicles.
Right. Okay. Wow.
So I do think sugar feeds acne.
And I suppose if you're going through stuff, you do tend to binge on foods that aren't particularly good for you. We've talked about donuts, bananas previously, and literally eating bad foods for you because you're in a mental health. As you mentioned, you use the phrase snowball, and I think that's so key, that you're seeing somebody that's come in for something to do with their skin, but you can trace it back, and it might not be solely that, but there might be elements of the mental health that isn't being looked after in the correct way that's coming out, and that is amazing.
Can I just go back to the point about the exercise?
Sure. Yeah.
We do occasionally see people who are on anabolic steroids.
Okay.
So there is a bit of a sort of epidemic in gyms where it's fairly easy to access anabolic steroids, and that can definitely flare up acne in quite a big way.
So is the treatment for that getting off steroids, basically? Or
for a start, yes. Yeah, absolutely.
But you said about it being bacterial, so I suppose there's also other treatments that they would have to undergo.
Well, there is, but remember, so acne is hormone-driven. So those anabolic steroids, they will drive the acne.
Because it's the hormones that.
And that's why teenage males generally get acne a lot worse than other cohorts.
Right, okay.
Wow.
It works that way. And correct me if I'm wrong, but anabolic steroids, that can affect your personality through, it's through your hormones, that again comes back to any mental health issues that you potentially have, or that you're feeling a bit vulnerable to.
Yeah.
That's just going to exacerbate that.
It just elevate everything. So like anger, irritability. What about happiness? Because obviously we're talking about the negative sides. But
so they do feel elated for a certain amount of time. But once they stop their cycle, then you can go into a fairly major depression.
Real crash.
Right, okay.
Well. Yeah.
Wow.
In terms of happiness, right? Because it's quite often, I feel like I'm a happy little.
I feel this is going to be a massive question, a life-changing question.
No, but in terms of that, do you see people that their skin is going through something? They do the treatments and stuff, but then their mood changes. They go away. There's a different life change, and they're slightly happier, whether that be through a change of partner, a change of location, change of job, and stuff. Do you see an improvement within their physical health?
Yes.
Straight away?
Yeah. Not straight away,
okay.
But it takes time.
Yeah.
But yes, you can.
You know, and skin conditions and stuff like that can be better because of that.
Yep.
Isn't it? It's amazing, isn't it? That mood drives mental health, but also physical health, and they're so intertwined. And as we mentioned right at the start, 20 years ago they weren't intertwined. Don't be ridiculous. You take a pill for that, and then you go and talk to somebody about that, and the changes now, which I think is wonderful. Because people aren't going, well, this I have to do this. And no, these are interlinked, and it can really change your life through better ways, cognitive stuff.
I think one of the issues also is not only do we have social media, but now we have AI and we have things like ChatGPT. So a lot of information is accessible to the general population, which I think is amazing. I think is absolutely great.
Okay.
But unfortunately, it does sometimes feed that health anxiety.
Really?
Of
whenever you Google it, right? It's
don't Google it.
Yeah,
never Google it.
It's one of the worst things.
Yeah.
As a GP, would you recommend people Google it before they come in, or is that a no? I don't know if that's too.
Emmett's laughing. He's like, no, he can't say it strongly enough.
I think it's fair to be informed.
Right.
Absolutely.
Yeah.
So you can have a good, honest conversation. With the practitioner.
Yeah.
But I generally find the rarest things are the top of the search engine in Google, and the most common things are right at the bottom.
Really?
And we have an adage in primary care: common is common. So general presentations we see are much more common, and the rarer things, unfortunately, yes, they do happen, but they are very rare.
But they're the ones. But they're the ones that people read, because nowadays with, as you said, social media, the news as it's reported to, we read the headlines. I've read the top one. That's obviously what it is, and you go, "Oh no, that's gone." Then you must, and that must drive paranoia and fear. You come in and go, "Right, well, I've probably only got a week left, doc." So because they've read that,
It does drive it, and so I'm not against it. I do think it's a very good idea.
Yeah,
and also for patients to be aware of the possibilities of what they could have. So like I said, you can have that conversation, and then if we think it's appropriate to investigate, then we'll do that.
It's a whole new world out there. It really is.
It is.
Emmett, I admit I can't say dermatology, but we'll learn. We've got some training to do with that. No, I know. I just want to thank you so much for coming in. It's been
Very
brilliant
welcome.
to speak to you, because I say I think the more and more, and I say I learn every time we have these conversations, but the real medical conditions that are being driven by mental health and the crossover is phenomenal to understand. And there'll be
really
people out there, that are going,
it's a pleasure to be here.
There's something there for me to have those conversations.
And hopefully it helps some people, as always. And
absolutely.
Whether it's to do with makeup or what to
on the
expect from a
makeup
mental health appointment at the GP or anything like that, hopefully this encourages people to not just go and suss things out that might be going wrong, but to look after themselves a bit more as well, because we spoke about all of the lifestyle stuff, and we've done a banana and donut show, haven't we? So people can go and find out about lifestyle and different things on our website too, of things that you can do to make yourself feel better and help with your dermatological.
Don't you're taking the mickey out of me now. This is just because I mentioned you'd look lovely with rouge. That's what it is. Thank you very much for joining us, gentlemen. That was the Down But Not Out podcast with Arthur Ellis here on MKFM.